Welcome back, everybody. Phones tell you when the weather's about to change or the aches and pains becoming more frequent. When over-the-counter medications aren't working, it might be something more serious than just a few aches and pains. It could be a symptom of arthritis. So please welcome back rheumatologist Dr. Samuel Pegram. He is the founder of the Rheumatic Disease Clinic. All right. At the top of the show, we had an email where someone said, here it is right here, I am in my mid-20s, but I have extreme joint pain. Could it be arthritis? Isn't that something that happens in old age? A myth that a lot of people believe.
Excellent question. In fact, most people equate arthritis with aging, but actually most of the more severe forms of arthritis are in young people, actually aged predominantly 30 to 40 years of age.
Babies can be born with arthritis.
Babies can be born with arthritis, so it can actually happen any age. But the more severe forms of arthritis are predominantly during childbearing years, between late 20s up to about 45.
Yeah, and mostly women for some reason.
Mostly women, unfortunately, and the reasons are really not known.
Okay. Let's back up and explain what arthritis really is. What is happening inside the body that causes these problems?
It's important to talk about what type of arthritis.
Okay.
If we look at the arthritis
over 100
of
types?
age, there's multiple types, but the most common type is degenerative joint disease or osteoarthritis, which is a gradual withering away of the cartilage and the surfaces around the ends of the bones. That's a slow to progress process, whereas the more deforming form of arthritis, rheumatoid, actually has nothing to do initially with bone or cartilage, but is a growth of the lining around the ends of the bones that subsequently causes destruction.
And we can see in those pictures right there, which affects mobility, which,
exactly.
you know, all right. And so we commonly refer to arthritis and some other things like lupus as an autoimmune disease.
Yes. Autoimmune predominantly means that the body fails to recognize self as self, and thus it sees parts of the body as foreign, and so the immune system does what it's supposed to. It tries to eradicate that abnormal tissue, but unfortunately that tissue happens to be your own.
Yeah, it's one of those things that affects millions and millions of people.
Yes.
People are searching for the answer. You have the Rheumatic Disease Clinic, which is amazing because this is what you are experts at, what you focus on. All right, different methods of treatment depending on what kind of arthritis you have and the severity.
Yes, and that's important because people think of arthritis that all the treatments are the same. In fact, the treatments are quite variable. If you have patients who have degenerative processes, the treatment is primarily symptomatic. If you have patients who have inflammatory forms of arthritis like lupus or rheumatoid, those patients are on processes or drugs that are actually designed to put the disease into remission and prevent progression.
Okay, so you can use drugs, some other types of things that you suggest people do to lessen the...
Absolutely. There are all kinds of alternative modes of therapy that actually are complementary. We as physicians actually prescribe the medications, but other important aspects of treatment in arthritis is maintaining good weight control, also to make sure dietary habits are significantly normal, decrease fat, improve exercise, decrease salt intake, those types of things. And there are also other types of issues that are important, such as exercise. But the type of exercise is important. Stress-loading types of exercise, such as running, which we often equate as being healthy
like
for patients with arthritis,
is
not. But swimming is actually
want to round out with the fact that you are constantly looking for the right answers, and so people can take part in some trials? Absolutely.
One of the problems we have in arthritic conditions is that we really don't know all the answers, and so research is paramount in this particular subspecialty. We at the Rheumatic Disease Clinic have a Rheumatic Disease Clinic Research Center where we participate in a number of clinical trials, which allows our patients access to some of the newer medicines which are about to come on the market, and also allows us to have some idea about some of the cutting-edge things that are about to occur in the specialty.
This is amazing because I know so many people are out there suffering with this. I know my mom has rheumatoid arthritis as well. If you're interested in participating in research opportunities or scheduling an appointment, call the Rheumatic Disease Clinic at 713-521-7865. That number again, 713-521-7865. You can also find them on the web at rdch.org, rdch.org. Thank you very much, Doctor.
Thank you.
Up next, doctors told Connie DeMang that her tired